Hello class, my name is Kimberly Stern and I'll be presenting for my Module 2 discussion, Choice 4, Normal and Abnormal Curvatures of the Vertebral Column. So there are 5 regions of the vertebral column. It starts with C1 all the way to C7, which is the cervical vertebra. And then we have from T1 to T12, the thoracic vertebra. And then from L1 to L5, we have the lumbar vertebra, then we have the sacrum and the coccyx. To demonstrate that on my body, the cervical vertebra from C1 to C7 would be about from here to here. And then we have inferior to that, the thoracic vertebra, which is from T1 to T12, which ends right at about the last rib. And then from L1 to L5, we have the lumbar vertebra, and then we have the sacrum and the coccyx. The curvature. So the normal vertebral curvatures, this would be the cervical curvature, the thoracic curvature, the lumbar curvature, and the sacrococcygeal curvature. So there's a clear concave anteriorly for the thoracic curvature, a convex curvature anteriorly, concave posteriorly, and also, so this would be concave anteriorly, convex posteriorly. This would be convex anteriorly and concave posteriorly. And the sacrococcygeal curvature is concave anteriorly and convex posteriorly. And there you can see slightly here that there is, for the cervical curvature, it would be concave posteriorly and convex anteriorly. So abnormal curvatures of the vertebral column would cause these conditions. So starting with scoliosis, it is a abnormal lateral bending of the vertebral column. And you could see that in this image right here. Kyphosis is an excessive curvature of the upper thoracic vertebral column. An example of this would be like someone who is very bent over forward, like the Hunchback of Notre Dame, if you watch that movie. And lordosis is an excessive curvature in the lumbar region of the vertebral column. So this can happen with people who either have a large gut or maybe who are pregnant. So it's more natural for them to bend posteriorly, but to do that in an excessive way can cause lordosis. And for the case study for Robert, most likely his condition is lumbar lordosis. And is it reversible? Possibly. So the best treatment for Robert, if it is mild, would be weight loss. And if it is severe, then surgery. Thank you for watching.